Hackensack, I can tell you, has always been focused on the highest quality care, best-in-class physicians. And to that end, we always stay on the innovative edge of medicine and technology. The robotics program has been a home run for us.
My partners and I felt so strongly that we wanted to train future surgeons in robotic surgery that we formed our own fellowship. And ever since then, we've been training fellows in robotic surgery only and having them learn the latest techniques.
Eventually, we went with training everyone that works in the OR on robotics.
Everyone gets trained. The new hires, the new nurses who just came out of college, robotic training is incorporated into their rotation.
Because we don't see it as a specialty arm anymore. We see it as part of all the surgeries that we do.
As one probably understands, it's not just about the acquisition of an asset. It's about building a program.
The structure of our program is called vertical alignment.
The executive team and the goals that are set flow freely down to the OR, where the execution takes place. And then the challenges and goals from the OR flow equally back upwards to the C-suite.
It allows the folks who are working every day to take the issues they're having and push it upwards to create an ability to affect the change. And so by having that vertical alignment, you allow for transparency throughout, you allow for us to work as a team, you allow a voice to be heard, and it allows everyone sort of rowing in the same direction.
Since our nurses are very well educated and highly skilled in what they do in regards to robotic surgery, they have a sense of pride being a member of the robotic team.
Our culture, and I would argue the culture that one should be striving for, is one where you have buy-in from all parties, that all stakeholders feel part of something bigger. And the way we do that here at Hackensack Meridian Health is we create transparency. We create access to data.
We have a robotics service line team that meets monthly, and we really go over our data.
And it's useful, so you know where you are, where you can help people.
Every corporation talks about big data and how we're going to use the data to make changes. But actually being able to implement that and make it actionable is really hard. It's not as easy as you think. So that's where we partner with Intuitive. We share our data with them, and they share with us other data that we don't have access to, our instruments, our accessories, where we compare to the rest of the country, where do we compare to the region. And it is not all roses, right? There are times that we look at things and say, ooh, we can do this a lot better, or we should be doing this a lot differently. And there are times where we are happily surprised that we're doing better than we thought.
Robotics provides for an excellent patient experience.
When you look at the data, you want to say, if someone comes in overnight, that's the technology we want to use. We have the ORs, we've invested heavily in capital. We have the robots that we've invested in. So the more we use them 24/7, the more we could spread the overhead cost and reduce our cost per case variant.
Because all our staff are trained, we are able to provide 24/7 access for our surgeons here at Hackensack.
Robotics is very closely aligned to all of our strategies around the Quadruple Aim.
It's number one, putting the patient first at all times, number one. Number two, focusing on your quality metrics and focusing on your outcomes and your cost. Also focusing on the entire surgical team and giving them a voice.
As much as my role is important as the executive champion for robotics and strategic initiatives, it's really around the culture of quality that we have at Hackensack. Honestly, nobody does anything alone, and it takes a great team, which we've been able to assemble, whether it be the OR team, who really have rallied around robotics, and there's a tremendous amount of excitement around all the new technologies that are available to them. It's an incredible team, and everyone has a role in the successes of this program.
What we have learned here at this medical center, we are now taking and expanding it across the health system. Working together as a multidisciplinary team, you develop standards of care and you know what the variations are, and then you can have discussions.
Standardization, I think, is critical to the success of a program for multiple reasons. And again, it kind of fits into that concept of a quadruple aim. So from a surgeon satisfaction standpoint, having Generation 4 technology, I think, is critical.
In order for us to have best-in-class physicians, we need to be able to provide them with technologies that make them satisfied and engaged in the great care that they provide.
When Hackensack made the decision to standardize to fourth-generation technology, the commitment was not only to the surgeons to have the same experience in ambulatory or the main OR, but it was also to their staff and also to their patients.